A warm welcome. Myself, Ajitha Rani, Professor, Department of Psychiatric Nursing, Sri Balaji College of Nursing, Bharat University is going to present the topic on alcohol dependent syndrome. Alcohol, it is the most widely used drug in human history. Alcoholism is a disabling addictive disorder. It is characterized by compulsive and uncontrolled consumption of alcohol despite its negative effect on the drinker's health, relationships, and social state. Heavy consumption, which involves for more than just dependence, can cause untold misery to the individual, who is usually affected by other physical, psychological, and social disabilities as well as elsewhere in the world. The Global Status Report on Alcohol and Health 2014, released by the World Health Organization, states that around 40% of the total population of India consumes alcohol per year. According to WHO, alcohol dependence is defined as a cluster of behavioral, cognitive, and psychological phenomena that develop after repeated alcohol use. It is an addictive disorder. It has been consumed millennia worldwide for various religious, cultural activities and celebration. WHO has estimated that as of 2020, there were 380 million people with alcoholism. Alcohol use is a public health worldwide and a significant problem in India. Alcohol dependence is a widespread among people of all ages and socioeconomic groups. Persons with alcohol dependence face enormous health consequences. Alcohol dependence is a major cause of mortality and it is associated with psychiatric condition, neurological impairment, cardiovascular diseases, liver diseases, and malignant neoplasm. Psychiatric conditions associated with alcohol dependence include major depression, dysthymia, mania, panic disorders, phobia, generalized anxiety disorder, personality disorders, schizophrenia, and suicide. Psychiatric comorbidity in turn is associated with alcohol-related symptoms of greater severity. It is the recorded alcohol per capita in India regarding the alcohol consumptions by the type of alcoholic beverages. It was given by WHO in 2010. It clearly indicates that 48% of people in India consumes beer, 26% of people in India consumes wine, 18% of people in India consume spirit, and 8% includes others. Like every day when a person is drinking alcohol, there causes a lot of complications for him. The analysis of 2013's Records Bureau by National Crime Records India states that it is estimated that 2.5 million deaths worldwide are as a result of alcohol use and 15.3 million people suffer from drug use disorder. This is the report given by Indian Express 2017. It also states 15 people die every day from the effects of drinking alcohols. Indian Express in 2020 declared that One Indian dies every 96 minutes due to alcohol consumption, and it and the rate of this consumption keep on increasing. And same wise, this global status report on alcohol and health states that the harmful use of alcohol results in approximately 2.5 million deaths every year. Almost 4% of death contributed to alcohol use. The complications of alcohol includes low self-esteem, emotional immaturity, feeling of isolation, guilt. Their lack of self-esteem will affect every area of their lives, especially in making a good relation with other people. This is the significance and need for the study of alcoholism. The global report of WHO states that total alcohol per capita less than 15 years of age consumption in liters of pure alcohol of this project in 2015. The boundaries and the names shown, the destination used on this map may imply the expressions of alcohol in every country. The process of development of alcoholism. The process of development of alcoholism forms in 4 stages. The first one is experimental stage, and second one is recreational stage, third one is relaxational stage, and fourth one is compulsive stage. In experimental stage, people will have more curious, and curiosity will drive the patient or the person to consume alcohol. This most normally happens in adulthood and adolescence to test the taste of alcohol, or they develop the curiosity to know what is this alcohol, and they started to take alcohol. And this is the first stage in the process of development of alcoholism. The second stage is the recreational stage. Here, the person takes alcohol as a result for their recreation. Normally, during any festivals or during any celebrations or during any gather, the persons consumes alcohol. They feel that taking alcohol provides a great recreation to the particular person. This is the second stage of process of development of alcoholism, the recreational stage. The third stage in the process of development includes relaxational stage. Here, the person feels relaxed when he consumes alcohol. At times, whenever he wants to be relaxed, the person will consume alcohol. This normally starts slowly, and the process goes on like taking alcohol every weekend or festivals, or when they want to feel that they need to have a leisure time. The fourth stage in the process of development of alcoholism is the compulsive stage. And this is the stage when a person becomes compulsively addicted to the habit of taking alcohol. When the person is rightly identified before these 3 stages, we can prevent the person from entering into the stage of compulsive. When a person has entered into the stage of compulsive, it becomes very difficult to make the person to come back to these normal 3 stages. So, compulsive stage, it is the stage when a person needs a therapeutic treatment in recovering from this disorder. It is the progress in the prevalence of alcohol. The prevalence of alcohol among men and among women in India. It is India's alcohol atlas, which states clearly about the distributions of alcohol between the gender group. Let's go to the etiology of alcoholism. While dealing with the etiology of alcoholism, there comes of 5 categories: biological factors, biochemical factors, psychological factors, social factors, and pharmacological factors. The first one is biological factors. In this biological factors, the genetic factor plays a major role in determining the biological factor of the person. First degree relatives have double the risk in developing this disorder. Parents are highly inherit to transmit that genetic material to the next generations. The second one is biochemical factors. The release of neurotransmitter dopamine plays a major role in making balance of a person. Here, the release of dopamine in the mesolimbic system brings extreme happiness, that is euphoria, and inhibition of glutaminergic transmission mediates amnestic effect. And alcohol increase GABA, gamma aminobutyric acid, which is responsible for anxiolytic actions. It is also believed that serotonin also plays a major role in inhibiting a person in becoming addicted for this alcohol. In psychological factors, a person with antisocial personality disorder and borderline personality disorder are high risk for developing this alcoholism. When a person develops problem in the area of motivation, their level of perception, their level of learning, their previous attitudes and belief a person possesses plays a major role in determining the psychological factors of a person in alcoholism. If a person gets good motivation, if a person has a right level of perception, if a person has a good learning ability, that is a good resilience from doing well, and if he has a good attitude and belief in determining this acts of taking alcohol, will contribute much in the psychological factors. The next one is the social factors. In social factors, that includes the society, which contributes the family, the fashions, all contribute mainly in the social factors, especially a person and his surrounding environment plays a major role in determining a person's personality in social factors. That also includes increased social tolerance, decreased restriction, easy availability of the drugs, and the person's his own ethics of values of life. While dealing with the pharmacological factors, some drugs can cause addict by itself. In a country like India, the drug availability and the drugs accessibility and the drugs affordability plays a major role in determining the pharmacological factors of making a person to get addicted with alcoholism. So, when a person comes to the ward, we have to first find out whether the person has consumed alcohol. So, this is the screening test of alcoholism. In the screening test of alcoholism, we normally ask questions to the persons, that is, have you ever thought of this alcoholism. That's the C stands for cut down, and A stands for annoyed, and G stands for guilty, and E for eye open. In C, cut down, we ask the patient, have you ever had the thought to cut down the alcoholism? And in annoyed, we ask the patient, have you felt annoyed to know that you have the habit of taking alcoholism? In G, guilty, we ask the person that you felt guilty in taking this alcoholism. And E stands for eye opener. Here we ask the client whether the person have or developed the attitude or tendency to have alcohol when he opens the eyes. This is the screening test for alcoholism, and when we get two positive answers from all these four questions, we understand that provides a positive test for alcoholism. This is the graph that shows the death due to the influence of alcohol. In 2009, it was 4,483. In 2010, it was 4,886. And in 2011, it was 4,547. And 2012, it was 5,478. And in 2013, 5,580. And the graph goes rising. In response to the COVID-19 pandemic, as with other countries across the world, the central government and state government of India initiated several measures to slow down the spread of the virus and to flatten the curve. One such measure was total lockdown for several months across the country. A complex and unexpected outcome of the lockdown, which has medical, ethical, economic, and social dimension, is related to alcohol consumption. The lockdown and consequent acute non-availability of alcohol result in the people with alcohol dependence going into withdrawal stage, black marketing of alcohol, and in extreme cases, suicides result from the alleged frustrations of not having access to alcohol. The Indian states and its death rate due to consumption of poisonous liquor. This also keeps increasing every year, and this is the state with highest number of deaths caused by poisoning after consumption of poisonous liquor. Here stands first in the place of Tamil Nadu, next Punjab, Karnataka, West Bengal, Gujarat, Andhra Pradesh, Uttar Pradesh, Bihar, Haryana, Jharkhand, Maharashtra, Chhattisgarh, Odisha, and Delhi. And the state government as well as the central government is taking immense action in stopping those deaths caused by poisoning after consumption of spurious or poisonous liquor. The next one is the physical complication of alcoholism. Alcoholism not only affect a person's individual part as a whole, that have effects on every organ of the person, which includes impaired memory, lesser ability to focus, vision changes, Wernicke-Korsakoff syndrome, chronic fatigue, ataxia, cirrhosis, chronic gastritis, pancreatitis, alcoholic cardiomyopathy, cancer, bleeding esophageal varices. Let's see by one system-wise the physical complications of alcoholism, which includes gastrointestinal, liver, pancreas, cardiovascular, blood, muscle, skin, nutrition, joints, reproductive system, pregnancy, and nervous system. In gastrointestinal system, let's see one by one what all the changes occurs. The first one is dyspepsia. Then indigestion is very common among alcohol-dependent patients. The main thing is when a person takes alcohol for prolonged year, they start to skip the normal diet and keep on taking alcohol, which directly or indirectly affects the digestive system of the person. Second one, vomiting. The persons may or may not have the influence of vomiting very frequently. The persons develop for prolonged period of consuming alcohols may result in acute or chronic gastritis. It also causes peptic ulcer, that is, the inflammation of the stomach may occur because of taking alcohol for prolonged years. In liver, fat degeneration of liver. The liver starts to destroy by its own in the method of autopsy, and this can be regulated. Alcoholic hepatitis will occur, cirrhosis of the liver will occur, and carcinoma of the liver occur in a person who consumes alcohol for continuous prolonged years. Here the changes in the pancreas, cardiovascular system and blood. In pancreas, it may result in acute or chronic pancreatitis. In cardiovascular system, continuous taking of alcohol may lead to alcoholic cardiomyopathy, and this person's a high risk for myocardial infarction. In blood, folic acid deficiency anemia and decreased WBC productions may occur. In muscles, due to consumptions of heavy alcohol, results in peripheral muscle weakness, wasting of muscle. In skin, due to continuous taking of alcohol, the skin have dehydration and ends in spider angioma and acne. In nutrition, as the persons keep on taking alcohol and when they skip the normal diet, they may end up in protein malnutrition and vitamin deficiency. In joints, gout occurs due to continuous and increased accumulation of uric acid. In joints, reproductive system, in males, sexual dysfunction occurs, and in females, failure of ovulation occurs for females. In pregnancy, fetal alcohol syndrome occurs. This affects the persons of the fetus and results in mental retardations and growth abnormalities. In nervous system, it includes alcoholic peripheral neuropathy and Wernicke-Korsakoff syndromes where there is deficiency of thiamine. Next one is the psychiatric complications of alcohol use. Here it includes pathological intoxication, withdrawal phenomena, delirium tremens, alcoholic hallucinations, alcoholic psychosis, delusional disorder, alcoholism and depression, alcoholism and criminality, alcoholism and sex, alcoholic amnestic disorder, and alcoholic dementia. In pathological intoxication, maladaptive behavior such as fighting, impaired judgment, physiological symptoms like slurred speech, unsteady gait, and psychological changes such as mood changes and impaired attentions will be there. In withdrawal phenomena, the general withdrawal phenomena are tremors, vomiting, malaise, elevated BP, irritability, anorexia, and insomnia. In delirium tremens, it is a complicated withdrawal state and acute organic mental disorder that should be treated as psychiatric emergency. Delirium tremor is a short-lived but occasionally life-threatening toxic confusion stage with accompanying somatic symptoms. These predominant symptoms are insomnia, tremors, and fear and occasionally convulsions. The classical features of this delirium tremens includes altered consciousness and confusion, auditory and visual hallucination, marked tremor and fever, delusion, agitation, increased ANS activities. And mainly, we give the treatment of hospitalization, IV fluids, injection thiamine and B complex, multivitamins, benzodiazepam to reduce agitation and restlessness and prevent the withdrawal fits. Next one is alcoholic hallucinosis. Vivid hallucinations developed shortly after cessation of reduction of alcohol. In alcoholic psychosis, person drinking alcohol for a long time in large quantities are prone to develop psychotic disorder which resembles paranoid schizophrenia with clinical features like behavior problems, thought disturbances, hallucinations, and impairment of memory. And delusional disorder, a paranoid disorder with predominant delusion of fidelity or spouse. Commonly, it's end with having suspiciousness towards the opposite partner. In delusional disorder, the person seems to have highly suspicious towards the partners. Alcoholism and depression. Alcoholism persons are prone to develop depression. To get relief from depression, the persons start alcohol, which will further aggravate the depression. Attempted suicide are common in this type of alcoholism. Alcoholism and criminality. Alcohol reduces and increases hostile behavior, hence alcohols are more prone for antisocial activities and behaviors. Alcoholisms and sex. In alcoholisms and sex, alcohol increase the sexual desire but takes away the performance, and alcoholic males suffer from sexual dysfunction. In alcohol amnestic disorder, impairment in short and long-term memory with disorientations and confabulations will be there. In alcoholic dementia, a chronic organic mental disorder due to long-term alcohol drinking, irreversible impairment in memory, orientation, impulse control, ability to solve problems may be there. And social complications of alcoholism. While dealing with the social complication of alcoholism, it falls under three categories: work problem, family problem, and drunken driving. In work problem, decreased work performance, hence decreased productivity. As a result, the economy of the family will be affected. When the economy of the family is affected, the whole nation suffers. In family problem, alcoholism is a disease which not only affects the individual but as the whole family get affected due to loss of job, loss of income, that will reduce the economic and life status of the person in a miserable condition. There will be a role model reversible. The winner becomes an alcoholic and the wife takes the role of earning, which results in the hormonal dysfunction in the family. In drunken driving, the Indian Express 2020 states that 40% of accidents in India occur due to drinking alcohol. The next one is the management of alcoholism. The management of alcoholism includes assessment of the patient, physical methods of treatment, pharmacological treatment, psychological therapies, and rehabilitation. In the management of alcoholism also include assessment of patient, family and work environment, history of drinking pattern, comorbid physical and psychological disorders. In physical method of treatment, first one is detoxification. In detoxification, it is the process of which an alcohol-dependent person recovers from the intoxicating effect of alcohol. It includes administration of anti-anxiety drugs, vitamin supplements, rehydrations, therapy to prevent electrolyte imbalance, glucose treatment to prevent hypoglycemia, and antibiotics to prevent any infections. In pharmacological treatment, we provide disulfiram 250 mg, acompressate 333 mg, naltrexone 50 mg tablet for the patients. In psychological therapies, we provide counseling. This counseling can be given by a person who gets trained in providing alcoholic counseling for the patients. So a lot of options can be given for the patients, and the patients are asked to select to mend their own life. The counselor will help the person to direct the right way, to develop a pathway to remove the habit of having alcohol in the life. In individual and group physiotherapies, that it includes the person will be given counseling as an individual or as a group to develop a good resilience for the persons and to develop a good resilience and self-esteem for this individual. Family and marital therapy, which includes the psychiatric field, gives treatment not only for the patient but the individual as a whole family. The whole family will be given treatment, and various methods and various management and treatment plans will be provided to the family in encouraging and supporting the patient to develop a good coping mechanism from this habit of alcoholism. Behavior modification. A behavior modification plan will be given for the client. The positives and negatives of their activities will be analyzed, and the best way of modifying themselves will be taught for the patient so that they can have a good modification in their life. Relapse prevention therapy. This is the method we provide and help the patient to develop and stop from the habit of getting addicted to